Hello and welcome. Welcome to my YouTube channel PharMaven. In this channel, I am sharing specific information about pharmaceutical industry, about injectable manufacturing, about incidents, investigation, about how to face audits. There are a lot of video. You can go to my channel and refer to it. In this specific video, I will talk about incident investigation using method as a one of the root cause, or as a method as a one of the investigation tool. So what we have observed, human error is mostly assigned as a root cause for the most of the investigation or many of the investigation, and nobody takes pain to go into the depth of the things. So in this specific video, I will take a specific example to make you understand how a human error, how an incident concluded as a human error was not actually human error, but it was a method or procedural gap into the system. So let us start with my example. So in one of the critical equipment, after the process has been run, after the cycle has been run, when we are checking the report, it was observed that the wrong recipe was run into that specific cycle, and the investigation concluded as a human error, stating that the person has selected the wrong recipe and run the cycle, because of which it run as a wrong recipe. So is it really a root cause? Let us understand. So after this primary conclusion of human error, when it was investigated in depth, then there are a lot of serious findings, lot of basic gaps into the system. So first and foremost, the interview of the person was not done thoroughly. It was done after 6 days of the investigation, and by the time the person has forgotten many of the things. So that is the most, or one of the most impacting reason that why we are not able to conclude correct root cause, because the interaction with the people occurs after 5-6 days, or sometimes even after 10-15 days. So when the in-depth interaction with the person was done and the team went to the equipment along with the operator, what they came to know that as per the procedure or as per the requirement of the machine, once you select the recipe, there is another button called upload is there, another touchscreen button is there which states upload. So once you select recipe, you have to upload it. But when it was checked with the SOP states about the selection of the recipe, but it doesn't state about uploading or pushing or pressing the upload button to upload the recipe. The operators were doing it by practice. They know the machine, so they were doing by practice, but they didn't realize that this instruction is not there in the SOP. So in that specific case, when detailed interview was done, it was identified that person has selected the correct recipe, but he forget to upload. Because of that, the last uploaded recipe was run into the system, which resulted into this specific incident. Now further to that, for a critical instrument, it is very necessary. So once you upload the recipe, you have to check it. Once you select the recipe, you have to check it that correct parameters are there into the system. So SOP was lacking that specific instruction that after you select the recipe, check the same parameters are there into the system by taking printout or by going to that specific recipe selection page or recipe parameters page. So that specific instruction was not there in the SOP. When we further digged into the system, it was identified that this specific activity doesn't require any checkpoint. So this is I am taking as a hypothetical example, so I can cover all possible causes as a method. So specific action or checkpoint after SOP after the recipe is selected, after it is uploaded, after it is checked by one person, it has to be checked by another person. This specific instruction was missing. It also lacks the clear-cut instruction to check the parameters of the recipe with the BMR or SOP. This specific instruction was not there. So are you realizing that initially this investigation was concluded as human error by the person by selecting the wrong recipe, but when we go into the depth of the things, we identified that there are many procedural gaps are there into the system. You might have one or two, or you might have certain procedure, but out of these 3-4 missing steps, if you have one step missing, either pressing upload button, either checking recipe after you upload, either matching with the BMR, either missing a cross check function, so one person enters, another person checks it. If it is not there, There is possibility that okay, you are running your machine without incident, but there is possibility that this incident can occur to you also. To further investigate after further investigation, it was identified that there was another big problem. So the recipe parameters which are there into the system were not meeting meeting with the validated parameters. So what was validated was not meeting the parameters which are into the system which is being routinely run. So you can are you getting the point that the simple incident is now getting to the which level of depth? There is a missing link between validated parameter and the routine parameter which we have to run. Further investigated why it has happened. So there is a clear missing of the any procedural control that what you have validated should go to the equipment PLC or HMI. There was no procedure at all. After the validation completed, it was intimated, but there was no formal handover of the document, no formal entering into the HMI, no formal check by the one person, cross check by the QA person that correct recipe is loaded. So these many gaps can be there in your system also. If you are superficially investigating your investigation, not going into the depth of the things, then this can be your problems also. So I hope you understand that the method is very, very, very important investigation tool or important root cause after your investigation, that even a simplest looking human error can be resulted after your so many gaps into your system. So hope this helps in your further investigation. If you like, you can subscribe to my channel. Thank you very much for watching my video.